this week's PhysioMed podcast. I'm here at the Rogers Center location, located right inside the Renaissance Hotel, and I'm here with Nitin.
Good morning.
Good morning. Who is a physiotherapist here, and with the whole Rio Olympics trending right now, we're going to talk about some cupping. So, what exactly is cupping?
Well, cupping is a form of treatment which is done by the use of cups. So it's basically silicone cups. It's as the word goes, cupping, right? But the interesting fact about cupping is that it has been in the field for over 5,000 years. It was basically used in ancient Chinese medicine, one of the treatments. Not commonly accepted in North America, but still used in Middle East. Ancient Chinese medicine regularly uses it, and now it's been a trending thing in sports too for athletes.
So has it only current or recently been trending in North America athletes?
It's been there for a while, but now because of most of the athletes in Olympics, we've heard about Michael Phelps been getting cupping done and other athletes.
Yeah.
It's out there and people want to try it. So it's a form of treatment. Basically, incorporates the use of cups, silicone cups, and for patients who are presenting with tight muscles, it's basically works wonders for them.
Okay, and what's the history behind cupping? How is this discovered?
So the practice of cupping is believed to date back to like 5,000 years. And one of the oldest medical textbooks in the world has described Egyptians use the cupping dating back to 3,500 years ago.
Wow.
So in China, archaeologists have found evidence of using medical cupping 3,000 years ago. So although a few thousand years have passed and cupping continues to be a common medical intervention in traditional Chinese medicine and some parts of Middle East, but the practice is still not accepted, I'll be honest, like in healthcare providers in Europe and North America. But now,
a bit more rare.
Right. But now, because of the benefits of cupping, people have been using it in their medical practice, especially massage therapists, sports therapists, physiotherapists around the world. They're using it and they're getting great results.
Okay, and now, what is the process of cupping? What can someone expect?
Well, when a patient walks in with a pain, so let me put it this way. Let's talk about athletes now.
Mm-hmm.
So if a runner comes to a clinic and they present with tight knee, like painful knee, I'm going to say tight knee, it's a painful knee, the differential diagnosis, which is like you can put up many things out there. It might be something related to the knee joint, or it can be muscles.
Mm-hmm.
Most of the times when we have seen in our clinical practice, it's basically because of a tight muscle, which is known as an IT band. And that runs around this side of your leg and goes right in front of the knee, outer thigh, and goes around front of the knee. When that muscle or that band gets tight, it can present as a knee pain. Now, when the muscle or the band is tight, we should understand that the movements are basically produced by the muscles, by contraction of the muscles. And if a muscle is tight, it won't produce that much movement. So, you will compensate to achieve a movement.
Right.
And that leads to pain.
Exactly. Else on your body.
So what cupping does, it's basically a form of a myofascial release. So muscle, fascia as a fascia, overlying fascia, when that gets tight, that gets adhered to each other, that reduces the quality of movement. So that fascia has to be released.
Right.
That muscle has to be released because it's
if
that
it's not,
tight.
and you continue
Exactly.
sort of straining yourself.
Exactly. So cup, what it does is basically when we use cupping, it has a suction pressure. It pulls the skin fascia up, and what we do here at the clinic, we mobilize it with the movement. So there are many types of cupping. Let me touch base on that. So there's wet cupping, there's dry cupping. I'm not going to what wet cupping is, but for dry cupping, it's basically using cups, and either you can leave it on the skin, which sucks the skin up, and now what happens is it improves the blood circulation.
Okay.
But at the Rogers Center here, we do something known as a tissue distraction technique with movement. So distraction is basically pulling something up.
Right.
And then we are mobilizing the skin of the fascia.
So you're moving this cup.
Exactly.
Along.
And we encourage patients to take participation, like active participation. How? They do the movement. Either there can be active movements, which is completely done by the patients, or it can be an active assisted movement where we can assist the patient in the process. So cupping, if we take any group of muscle, we use a cup, depending on the size of the area, and then we mobilize the cup, we move the cup, at the same time, patient would do the movement.
With the cup?
With the cup.
Okay.
So that kind of loosens the fascia muscles up so that any tight muscles can be worked on.
Okay. Is it a painful process?
It's not really painful, but let me ask you, if you have had a massage done, it can also get painful.
It's a good
right.
pain.
It's a good pain. So
pain.
Once you get cupping, we've got like positive reviews from all our patients that we use, and though the initial phase is always sensitive, everyone's threshold is different.
Of course.
But we make sure that we don't hurt patients, but at the end of the day, it's a good pain, right? And we always use these kind of techniques in adjunct to physio techniques that we use, like mobilizing the joints, mobilizing the patients, like activating muscle strengthening.
Okay.
So it can be used with different techniques in the clinic.
Okay. And so if I'm not an athlete, what would be a reason for me to come in for cupping or a cupping session?
Tight muscles. It's not like only athletes have tight muscles.
Right.
With someone sitting for long hours, say, I call it an IT syndrome. When people sit for long hours, they present with neck pain, back pain. The interesting part about these patients is they always present with tight muscles in their back, low back or upper back. And when they come in, we've been using this technique on those patients, and it's been working well with them. So anyone who has like myofascial pain when they walk in, myofascial is basically muscle pain. But has fascia involved in it. You know what I mean?
Which is the skin?
Overlying
on
top of the muscle. So whenever there's a tight muscle, in order to release them, we use techniques like cupping. We also use active release techniques. And, like I said, it always works together with the treatments that we have at the clinic.
Okay. The reason it gained so much trending with the Olympics is because there's these circles on them, and it's kind of like red or almost like purple sometimes. What is that? Is that because
increase in the blood circulation?
Okay.
So, for example, now if I don't have a cup now, right? So if I even pinch my skin and keep it like that for a long time, the skin color would kind of change.
Yeah.
Right. So that's what cupping is doing.
Okay.
It's producing that suction pressure there, which sucks the skin up and holds it there in the vacuum for some time. So the blood circulation increases.
How long is this cup on you? How long are you?
Well, ideally, if you're doing a cup in for where you're not moving it, it can be done from anywhere from 5 minutes to 30 minutes. But when we do it with the movement, we do it for 2 to 5 minutes max.
Okay, so it's not a very long process.
Long process, no. If you're moving it, because patients are active part of this process, it can get tiring if you do it for 30 minutes and make them
move
back and forth.
Yeah.
Exactly.
Okay, I see. Are there any other risks? Is there anywhere that you can't cup? I mean, there's muscles all over you, but I mean, is it safe to do anywhere? Is there any risk with it?
There are some important contraindications to this technique. I'll just touch base on some of them. One is a blood disease, which is hemophilia.
Right.
Yeah, hemophilia should not do cupping. Patients.
And that's what thins your blood, right?
Exactly.
Okay.
And patients on anticoagulants, like even regular aspirin, won't use that. So before taking any patient in for this process, we always have to make sure that we take good history. We know everything about them, and then we should proceed. So like I said, it's blood disease like hemophilia, patient on anticoagulants, dermatitis, which is a skin inflammation,
okay,
skin condition, open wound, a big no. You can never cup an open wound.
Yeah, because then you're just drawing out more blood.
And varicose vein, hernia, severe edema, congestive heart failure, renal failure, areas near large veins such as groin, infections, genital regions.
Okay,
those are some of the areas that we shouldn't be doing it, and some of the conditions where cupping is contraindicated.
Okay, and so do you find that you're mostly doing on the backs of people, or?
Well, like I said,
common?
Tight muscles can be found anywhere in the body. So some of the common regions that we commonly use is upper back, lower back. We do it on the quadricep, which is the front of the thigh, hamstrings. Can also use it on the joints like knees.
Oh, you could do it on joints.
Yes. So for anyone presenting with a joint pain, we can always use it on the knee, a big cup. There are different sizes of cups that we have. We can do it on the forearms. When someone sits and types for long hours and they are presenting with forearm tightness or pain, it can always be done there. So like I said,
kind of relieve the pain that comes with carpal tunnel and those things, because it's around the same region.
Around the same region, and if there's any tightness induced pain, that would release that.
Okay.
And it can be used in like I said, any tight muscle. It can be used, provided you know where to use and where not to use it.
Of course.
It can be we have cups of different sizes because every surface area is different. So it can be pretty much used at all the tight muscles.
Okay, and if someone wants to kind of regularly do this, like as an athlete, is there, do you do it every month? Do they do it every week, or just it's needed?
Depending on like how active they are and what kind of a participation like sports they are in, it can be done like on a regular basis. We have patients who've been coming in for a while and they get on a regular basis and it's been producing good results.
Oh, okay.
Yeah.
Awesome.
With that being said, active exercises play a very important role. Cupping is a process to release or relieve pain, but at the same time, muscle has two properties, that stretch and strengthen, right? So strengthening is something which cupping cannot do. Yeah. So we want patients to understand that when we do these techniques, exactly, they have to make sure that they take active participation in exercises, and plus these techniques can always help them to maintain the properties, but at the same time, we want to teach patients the skills so that they can take back and do things by themselves.
Oh yeah, because you can coordinate this in their program, but part of their program is maintaining it.
Exactly.
Okay. And you only do dry cupping, because you mentioned wet cupping.
Wet cupping is a process, I won't go in detail with that. Basically, it's done by making incisions on the skin and then using the cup. So, like I mentioned, incisions, we don't do any invasive things, so, we won't go further with that, but it's more like a dry cupping. And it's interesting to know the different type of cuppings that's out there. So, like I said, it's dry and wet, but dry can also be different types. So people, at times, when in Olympic or sports, they use like something like a pump to suck the skin. It's used over the cup. But what we do...
Oh, like a suction cup.
Suction,
okay.
Yeah. So what we do is like we can manually do the suction instead of having a pump.
Okay, how do you manually do that?
Manually do is like change the pressure, like just press the cup down and just put it on the skin.
Oh, I see.
And when you release that pressure,
the
amount of pressure that you want can always be altered, like depending on patient's comfort.
Okay. Is there an age limit? Like, do you do this on younger patients, or is it mostly just adults that have tired, achy muscles?
Yeah. So people who are young, pretty active. They have the tight muscles look really. We haven't seen that, like, different age groups will be different, like, for really someone who's like 8 or 10 year old, they won't be having like tight muscles.
Okay.
But adults, like working young professionals would have it because A, they might not be exercising, B, they might be exercising but not stretching.
Oh, yeah.
So when the muscles get tight, they need to be released, they have better control over the joint, and then when you strengthen it, that balances the stretch strength phenomena of the muscle.
Okay, and what are some of your other services that would complement cupping?
Cupping can be, the services that we have that complement cupping is stretching, strengthening, mobilizing. So any muscle which goes around the joint, if it's tight, they don't have that much control over the joint, right? So joints need to be mobilized. So if I think that there's a tight muscle and I'm trying to mobilize a joint, I won't be able to basically mobilize it to the limit I want to mobilize it because it's pulling. It's a constant fight between me and the muscle.
So it's kind of stacks on this other things and it helps everything.
And when cupping can be done, it can be released, and then the patient knows that how it feels like when the muscles are not tight, and they can recruit it like by exercises.
Okay.
And these are services like we can complement to cupping.
Oh, I see. All right. Thank you so much for this.
You're welcome.
Awesome. It was nice talking to you.
Same here.
Okay.